I'm a healthcare futurist, and so my perspective of the question of whether or not there's going to be variation across the country with regard to implementation of Obamacare really comes from my experience over the last 30 years working with various stakeholders and analyzing both the politics and policy changes in American healthcare. And what seems pretty clear to me is that we have two Americas emerging at least over the next 2 to 3 years. One America, basically the west of the country plus New England and New York, are embracing the Affordable Care Act's implementation, Obamacare. They're expanding Medicaid as envisioned in the law, and they are actively pursuing the establishment of state-based health insurance exchanges. On the other hand, you've got huge swaths of the country, about half of the population, mostly in red states, who are in states where governors have determined they're not going to actively expand Medicaid, and they're sort of passively aggressively resisting the formation of the federal health insurance exchange in their state. And what that probably means is we're going to see very big differences across the country in coverage expansion. One would argue that, states like Florida and Texas are going to do little or nothing actively, even though there are federal provisions in those states. And California is going gung-ho, as is Washington, Oregon, and New York. So we'll see. And then I think in the longer run, the question will be determined by the outcome of the 2014 and ultimately the 2016 elections as to whether this thing is dead or whether it's the future.